Hello, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. What I'd like to talk about today is a topic that affects pretty much everybody at some point. This is meant to be just a very general discussion about why this phenomenon happens, and not necessarily the cure or the treatment or the the process, but just a general understanding of, in particular, why after you've been sitting for a while or when you first get up in the morning, your back pain or your joint pain is so stiff and it feels like it's really hard to get going. Again, this is a phenomenon that pretty much affects everyone at some point in their lives. Um, as we age, as our bodies have different hormone levels, as our tissues degrade over a course of our lifetime, as we wear and tear on things, it becomes a little more apt to be stiff, harder to get moving because of um, the physiological nature of our muscles and our joints. So this is just a general overview again. So I'd like to talk again just about the spine, because we are talking specifically about back care and maintenance, just an overview of the spine. Um, and hopefully you can see my cursor here. So with your spine, you have your neck region, which is the cervical region, which has generally a concave shaped curve. And then the thoracic spine, which is your mid back, your upper trunk region. All your vital organs are kind of in this area. Your thoracic spine, your mid back, generally has a convex style curve, and then the low back, which is called the lumbar spine, generally has a concave curve again. And then down here at the bottom, you have your sacrum and your coccyx, which are technically two separate areas, but they're fused together essentially. So you can kind of treat them as one. Um, but so down here is your sacrum and your coccyx, and this is where your hip and everything is. Your pelvis is associated here. But generally, we're talking about four main regions: the cervical, the thoracic, the lumbar, and the sacrum slash coccyx. So now that you have a good understanding of the regions of the spine, let's talk about the actual joints and the muscles, just to understand why am I so stiff when I first get up in the morning. And on that note, why is it so important to, when you first get going in the morning, to stretch and to move your body, even if it's just laying in bed or sitting on the edge of the bed, to keep and to prime your joints for being able to do the things that they need to do. Um, so let's talk about the joints. Right here, you've got two vertebrae, which are the stacked bony elements of your spine. And then between the vertebra, particularly we're talking about this region right here, is called a facet joint. And the facet joint is the joint between each vertebra that allows it to move and to articulate on one another. It helps keep the structure, but also helps have a smooth surface and just allowing for fluid movement. Um, Normally, in this picture is good because you can see that there's a white kind of outer coating of this facet joint, and that is called the joint capsule or the capsular tissue. And that capsular tissue is very important. One, for keeping the joint approximated well, but two, for allowing a good environment so that the joint can maintain its joint health and can house the fluid that allows it to lubricate the joint in between each vertebra. So this capsule normally, in a young healthy individual, there's fluid, and this capsule has a certain integrity, but also has a certain ability to move. And as we age, this capsule can become tougher. It can become more brittle in the sense to where can shear and not move as fluidly. And then speaking of the fluid inside, that fluid over time can degrade in its production, leading to a not as mobile and not as easy to move and articulate surface. And that in particular, over a long period of time resting, such as sleeping overnight or sitting in a chair for a couple hours, really limits the amount of lubrication that is going on in the joint, making it that much harder to move. So here's a picture. This picture. Hopefully you can see on the right-hand side here. This is just another example of a facet joint, but between the joint is sort of a cavity that's just a little pocket where the fluid is there, and then there's normally smooth surface on either side of the joint that allows it to fluidly, using the fluid as lubricant, to move on one another. This is just another picture of the same thing as this, just it shows the joint cavity here. We'll come back to that. So inside the joint cavity is a fluid called synovial fluid. And this synovial fluid is what allows for the lubrication process to occur. Now, normally there's cells inside the capsular tissue, inside the joint itself, that can secrete this fluid, but can also reuptake and remove some of the bad metabolites so that your joint can maintain good health. But as we age, as wear and tear sets in, as the capsular tissue degrades over time, you can end up with what looks like this on the bottom, where the smooth cartilage surface is worn away. The bone has grown outside its normal areas, and that capsular tissue becomes really thin, and it doesn't have the same elasticity as it used to. It doesn't stretch, it doesn't move, it doesn't bend as it used to, making these joints a lot harder to move if they don't have the proper space and the proper lubrication. Now, something like this would be very painful, but even a little bit of mobility can prime this to secrete a little bit of fluid to allow for a more efficient movement. So this would be a severe case of facet joint arthritis, where the actual joint is just overgrown and rocky and not allowing for good movement. Let's see. So now that we've talked about the actual joints of the spine, we need to talk about the muscles too. I'm gonna bring up the picture of the muscles. So you might ask, well, why are you talking about muscles? We're talking about the spine and the bone. Well, the muscles are what are attached to the bony structure, and that's kind of this picture right here. This is supposed to be a bone in the background with a musculotendinous junction right here between the muscle and the bone. And your muscles are made up of these little fiber bundles that are surrounded by this sheath. There's a deep sheath, and then there's sort of a superficial sheath. And that sheath is very important. Similar to the capsular tissue, that sheath has a certain elasticity and needs to have the proper lubricant levels. It needs to have that the elasticity to be able to function. But also, if you've been sitting or you've been sleeping for a while in a certain position, you're not allowing the tissue to stretch, so that it's going to be super contracted, and it's not going to be able to expand when you need to, which is thus in turn going to pull and put a lot of pressure on the bones and the nerve structures. So your muscles, this kind of shadow right here, your muscles attach all along your back, and then even some to the front here, depending on where it's at. But if you can imagine, there's these big, thick muscle bands that are attaching to the spine in here. And if those aren't fully elongated or don't have the elasticity they should, it's going to put a lot of pressure on each one of these joints that the muscles are attached to the bone, which is in turn going to put a lot of pressure on the nerves that are coming out from the spine. So that's why it's so important to have good elasticity and properly stretch your muscles before moving, especially when you're first getting up in the morning. You probably want to stretch your legs, try to straighten your legs and then bend your legs, move your legs side to side, just to allow for one to get some of the joints moving, prime some of that capsular tissue to circulate the synovial fluid and all the other fluid in your joints, but also allow your muscles to stretch. So when you do get up and you do try to stand, it's not putting so much tension on your joints. It's a very important thing, that a concept to consider, um, that ease your way into the day. Maybe allow a little bit more time in the morning to stretch, to ease yourself up. Um, because if you wake up and then you just try to get up, you're more than likely going to have some discomfort because your body just hasn't gone through its normal designed for motion, um, to circulate the fluid, to stretch all these tissues. Whereas if you were to spend maybe 5 or 10 minutes to actually go through some movements, go through some stretching, you're allowing yourself a better chance to tolerate your especially early morning movements as well. Um, as well too, when you've been sitting in a chair for a while, sitting in a movie theater for a while, something along that nature where you're just not moving and your body is very static, it can have the same effect where the tissues have stiffened up. There's not as much fluid circulating inside the joints and lubricating the joints. So just something to be cautious about. Things that you can do and things that I typically prescribe to some of my patients who are having these issues is, say you're at a restaurant and you've been sitting for an hour, the service is slow, you've been sitting, you've been waiting, and you're finally ready to get up and leave. And you get up and, ooh, your back is just stiff. Something that I would try to do is, even though it may look a little bit funny, just underneath the table, try to slowly march with your legs, just elevating one, elevating the other, just doing it repeatedly a couple times, maybe like 10 times or so, and then trying to move your back. So maybe you sit against the back of the chair and try to flatten your back against the back of the chair and then arch it, and then try to flatten your back against the back of the chair and then arch it, just so you can move some of these joints. Let me go back to my picture. Move some of this stuff, particularly in your low back. So when you do get up, your body's primed to do what it needs to do, and you're not going to be so stiff and so in so much discomfort. Um, Something else to consider is being conscious of how long you sit. If you're sitting for an hour, I mean, that's probably too long. Maybe if you're at a meal, just get up, stand, maybe just take a lap around the dining room or something like that. Just something to be a little bit more cautious, and not allow some of these phenomenons as far as the joint immobility, the lack of circulation of fluid, the muscle stiffness to occur, being proactive about it. It's overall body health is about making lifestyle changes, and it may be, unfortunately, a lifestyle change that needs to occur so that it can give you the best opportunity to continue doing the things you want to do, like going out in the community, walking daily, doing things around the house, doing activities with as little pain as possible, being conscious and making active decisions about certain things. So again, I'm just going to review real fast. Your spine has four main regions: the cervical, the thoracic, the lumbar, which is the low back, which most people have trouble with, and then the sacrum and the coccyx, which we don't talk about a lot, but they do have some issues. But these are essentially just a fused structure. Between your joints, between each one of these little stacked elements, of the bone are a joint called a facet joint, which allows for the bone to slide and move on one another, but it's surrounded by this tough fibrous tissue that keeps the joint approximated well, but also allows some fluid called synovial fluid to circulate within. And that the tissue needs movement, and it needs actively moving your spine to trigger some of the circulation of that fluid, but also to take up some of the bad metabolites that occur just over time. Um, Similarly with your muscles which are attached to your spine, and if they don't have the proper elasticity and length, can really pull and do some damage, especially when you first get up after sitting for a while. And your muscles have all these little bundles that are surrounded by this fibrous sheath called fascia. There's sort of a deep layer, and then there's a superficial layer, but all of this tissue needs to have the proper lubrication and the proper elasticity to do what you need to do without pain. And if you're not being conscious of stretching, being conscious of moving and sitting for too long, or you sleep overnight and don't take some active steps to stretch before you get up, then it's going to be hard and it's going to be painful to get up because your body's just not primed to do what it needs to do. That's it. That's all I wanted to talk about today. Again, my name is George Wanamaker. I'm a physical therapist at Presbyterian Village, and this is a continuing series on back care and maintenance. Thank you.